I'm Dave Mullins. I'm a podiatric surgeon and healthcare attorney in Northern California. I'm also the author of the book, How to Win Medicare Appeals, published by the American Bar Association. This podcast is based on that book, and this is episode number 1 of the podcast. Let's get started. How difficult are most Medicare appeals? They're easy to do because there's a very small universe of Medicare law, because there are only 3 steps from start to finish in most Medicare appeals, because you're going to be dealing with the same issues over and over again, and because the Medicare administrative law judges are both knowledgeable and reasonable. Are medical appeals different from surgical appeals, different from drug appeals, different from DME, durable medical equipment appeals? No. Every Medicare appeal is the same appeal. How can that be? How can every Medicare appeal be the same? Because for every Medicare appeal, you're going to submit written answers to the same 5 questions before the administrative law judge hearing. And for every Medicare appeal, you're going to use the ALJ hearing to tell the patient's story the same way you would tell it to any layperson. What are these same 5 questions? 1. What was wrong with the patient? Don't underestimate the significance of that question. If the judge does not understand the medicine in the case, you're not going to win the appeal. 2. Exactly why did that problem require treatment? 3. Exactly what treatment was provided and why was that the best choice for that patient at that time? 4, and the most important of the 5 questions, how do you know that was the best choice? Meaning, what authorities support what was done? And 5, how were Medicare's denial reasons either wrongly applied or, more commonly, why should the Medicare payment policy that applies to your claim not be applied? Can Medicare appeals really be this easy? Surprisingly, yes. Who should be appealing the Medicare denials? Well, quite obviously, the Medicare providers should, but they don't do a very good job of it. So the appeals fall to the healthcare attorneys, to the legal nurse consultants, and especially to the coders and billers. Why especially coders and billers? Coders and billers are among the first to know when claims are not being paid. And who knows more about coding and billing than coders and billers? Do coders and billers have the skill set necessary for Medicare appeals? The skill set required for a Medicare appeal, up to and including the administrative law judge hearing, is only slightly greater than the skill set already possessed by the coders and billers. And if a coder or biller does not want to do the ALJ hearing on her own, she can always team up with a legal nurse consultant or an attorney for the actual ALJ hearings. Why would coders, billers, legal nurse consultants, and healthcare attorneys want to represent providers in Medicare appeals? Because Medicare appeals are easy to do, because Medicare appeals are cost-free to do, because Medicare appeals allow you to backfill your work schedule every day, because nothing attracts new clients and referrals like the successful representation of established clients, and because there's nothing wrong with making money. This podcast episode was based on How to Win Medicare Appeals, available at the ABA bookstore and on Amazon. When you go to the link below, please scroll down and take a look at the 2 chapters I asked the ABA folks to include within that online ad. If you do, I'm pretty sure you're going to select How to Win Medicare Appeals when you choose a book to help you do your Medicare appeals. We're going to do 1 episode a week. I'll see you in 1 week.